Hey, this is Jared Stansell. You can see me or not. Here's my name tag. I got my jacket on right here, so I'm in class. I'm here to do the rest of my newborn assessment, the added material. So you're going to have everything set up. You're going to have your blanket right here to keep the baby warm after you're done. You're going to have your gloves right here. And you're going to wash your hands before you do all this so you don't hurt the baby. Put my gloves on. Alright, so first of all, you're going to look from head to toe. So the head, you're going to be looking at their anterior fontanelle. Then you're going to look at their posterior fontanelle, look at their depressed or bulging. You're going to be looking at their hair, how much hair they have, if there's any bruising around their scalp. You're going to turn their head around, see if they have any, see if they have like a flat head, or see if they have any caput cystinotum, and also the cephalohematoma. So that's the scalp. You're also going to look at their suture lines and see like how well they're like laid out. So sometimes they're overlapping. They'll have like a ridge right there, but that'll all heal up in about like 18 months. You also have like the eye to ear measurement right here. Like if the outer cannula of the eye matches up with the top of the pinna of the ear, and that just shows that the baby has a congenital deformity, and their face just might look different, or they might have some type of different medical problem, but you just record that as data. So then you look at their eyes, see if they have any redness or bruising in the sclera of the eye. And also the color of their eye will be permanent, about 6 months or so. So if they have one color eye, they might have a different color later. They also might have cross eyes. Then this is about the point where you put like the silver nitrate in to protect them from bad bacteria. Then you look at their nose, put your finger under there, see if they're breathing okay, if you can feel warm air coming out. And I guess you can cover this one, put your finger down there, cover the right one, put your finger down there, see if they're both patent. And then you look at their mouth, open up their mouth a little bit, and then see if they have the, put one of your clean fingers in there and see if they have the sucking reflex. Then you also stroke the cheeks, see if they turn their head to your finger to suck your finger. And then you'd be looking inside their mouth, see if they have any Epstein pearls. They're just like white pustules in their mouth. They go all the way in their own. Shouldn't hurt the baby or anything. Yeah, most of all, just the molding, how the head is shaped, and reassuring the mother and everyone that it's going to be okay, and the baby will develop normally. You're just going to look at their skin around their neck and see if it's intact, any bruising again. So if there's any bruising right there, this one's perfectly healthy. So then you're going to get a stethoscope, not a normal one, but hopefully like a one for babies. These are smaller. You're going to have a watch right there. That's the second hand that goes all the way around. That goes 60 seconds. You're going to put your stethoscope right here on the apical pulse. And you're going to watch that for 60 seconds and count to see how much their heart beats during that time. Then you're going to try not to wake the baby or disturb the baby, and also take their lung sounds. So just listen for a couple times in each section. And now it's going to cry, so you want to try to do this as gently as you can. The breaths per minute is going to be normally between 30 and 60. And then the apical pulse is going to be between like 110, 160. Then for the lung sounds, you're going to make sure there's no wheezing, rhonchi, or anything abnormal. So you're going to know the clear lung sounds in all fields. Then you get your stethoscope back out. Listen to all the quadrants of their abdomen. And again, you would use your watch right here. Make sure it goes all the way around. And then you listen in each quadrant for a full minute, and they have to be 5 to 10 abdominal sounds in each quadrant to be normal active. If you listen for 3 to 5 minutes in one quadrant and there's no sounds, then that's no sounds in that quadrant. And that's usually pretty bad. Alright, now the reflexes. Basically, you want to put the hat back on, whether they're not crying so much. And you want to clap your hands, and then they like flex their arms and legs out really quick, then grasp, and that's the moral reflex. Then the tonic neck reflex. It's where if you turn their head like that, the opposite side of their body is going to flex, and the other side is going to be extended. Then you have the palmar grasp, which is if you stick your finger in the baby's hand, it'll grab your finger. And then the babinski reflex is if you stroke the outside of their foot, their toes will fan outward. That'll go away in about 4 months. Then blinking, you can do that at the same time you do the moral reflex. You just do that, and then as soon as you do that, they'll blink, and that just tells you if they could see if their blinking reflex is working. Oh yeah, and then you can, like the baby's looking that way at their mom or something, you can try to talk to it. Sometimes it'll look back at you if you're talking. That just shows if their hearing is working. Then you have vertical and horizontal eye following. So you just got something colorful. So I'm going to use my pen light. You can go this way, and I'll follow it. Then you go this way and follow it. Then you go up and down. They follow vertically. If they're not, that's probably not a good idea. Not good. They might have messed up cranial nerves. Let's see. Then just for a general skin assessment, you're going to be looking for acrocyanosis, which is just because of high hemoglobin and their circulation is not where it should be. Like, it's not the same as an adult. Then you're going to you're going to be looking for port wine stains, especially because they're permanent skin markings that have to be surgically removed, and they're usually on the face, around the eye. And they're dark pink skin discolorations compared to the other skin around them. And then you're going to be looking at their cord. This one, diaper is too high on this baby, so you want to tuck the diaper down like that, so it's away from the cord. Make sure there's a clamp on it, the way it's not open and bleeding. There should be 2 arteries, 1 vein. Should be kept dry at all times, and when you're doing a bath, they can wash it with mild soap and water. They just can't use anything else. No Vaseline, petroleum, anything like that. Just need to stay dry and monitor for bleeding and infection. Then another thing with the skin is witch's milk, which is just a substance that comes out of their nipples sometimes. Only 5% of babies. It's from like a hormonal. It's from the mother's hormones before birth. That's what causes them to secrete this substance. And then take the diaper off and look at the genitalia and see if the testes are descended or still in the abdominal cavity or pelvic cavity, and see if their sac is normal, if there are any like open sutures or anything. You look at if they're a woman, if they're a girl, you look at their vagina, see if it's bulging or inflamed or any abnormal discharge, like green or yellow or something. They're supposed to have white and red discharge if they're a woman, and that's from hormonal withdrawal from the mother. So it'll go away on its own until puberty. Then you're just going to look at their extremities again and see if they're all flexed. See if they have any like legs that are just hanging off, not doing anything. Check to see if they have any extra digits or extra toes, any webbing, any bruising or scratches or anything like that. And that's the rest of my material.